Hi, this is Noelle Borders, and I'm here to explain to you about Project Discharge and your role in Project Discharge. And this is for both providers and for nurses. So when our patients walk into OB Triage, they are there for a reason. They need help, they need questions answered, they're not feeling well, and it's our job not only to help them, but also to provide them with information when they leave OB Triage to know how to take care of themselves at home, and hopefully so they feel confident about themselves and their care and their pregnancies. The other thing is that OB Triage is an emergency room, and in emergency rooms, it's the standard of care for a patient to receive discharge teaching and actually a discharge summary. And the goal of this project is that 65% of our patients will leave OB Triage with an effective patient-centered discharge process and receive a discharge summary as they leave. So when the patient walks in, one of the first things that will happen is that the clerk is going to print off her medication list, that she will ask that the patient cross off the medications that she's no longer using, and then the RN will confirm that, and that medication list will go on her clipboard. It's then the provider's job to do med reconciliation before the patient leaves. There are 3 different forms that are part of this discharge process. There's a discharge checklist, a discharge summary, which is a duplicate, and the patient will get the yellow form when she leaves. And there's also a patient decision aid, and I'm going to go through these one by one. The checklist is simply a checklist, and it's for your reference and to use to make sure that the patient gets everything she needs before she leaves. The first 3 items are for providers only. The nurses can't do these. It's the MSE determination and disposition, that the discharge order is placed, and that med reconciliation is done. And these are things that many of us are doing already, but this is to make sure that we remember to do them. This checklist can be used by RNs and providers. It's not for one or the other, but for both. And this is also a great piece that can help with a conversation, which is the next task on this list. It's not really a task, it's just something that we should all be doing, is talking to each other about our patients to make sure that we're providing them care effectively and efficiently. The next item on the list is the discharge summary, as I spoke of, and we'll talk about that in a second. And it says yellow copy given to patient, because that's really important that she get that when she leaves. The next item is, what is OB Triage, a patient decision aid? A patient decision aid is just a tool that we can use to start a conversation with a patient. And in this case, this one is, what is OB Triage? And this one's in Vietnamese because we have it in Vietnamese, Spanish, and English. This decision aid is, again, information about what is triage, when should you come, and when could you maybe call clinic for an appointment if that's possible. One thing that's important about this is that it's a tool, again, to help give the patient information, not to shame her, and we certainly don't want our patients thinking that they're not welcome. They're always welcome in triage. But we'd also be happy, and they would be happy if they come when they know that they really need to, because women don't want to bother us, and they feel badly if they come and they feel like they shouldn't have come. So anyway, that's this tool. And this can be used at any point during her visit if it's appropriate. And again, it's really up to the provider and the nurse to think about, is this appropriate for the patient? It's probably not appropriate if she's having a miscarriage, or something else when she is maybe in a lot of pain. Obviously, we're not going to try to teach someone when they're in a lot of pain. So again, just important that we use this when it's appropriate. Back to the checklist, there is one question on the discharge survey, the discharge summary, that's a survey question about the decision aid, and she can fill that out toward the end or at any point during her time in triage. Education handouts documented in PowerChart is another task, and there are now education handouts that you can pull from PowerChart, and they're not only, you can print them from PowerChart, but you can also, when you print them, they're documented that you gave them to the patient. And many of those are under OBGYN, but you can use any of the education handouts that you can find in PowerChart. And then the last item on this list is primary prenatal care provider notified of OB Triage visit. Now, this can be a little tricky if patients are out of the UNM system. You can often find providers and send them a letter. You can send PowerChart messages to providers in the system, and you can also just forward the note that you write. And that is really up to individual departments or divisions to figure out how they want to do that. So again, taking that then to your division and figuring out how you want to do that is another step in this process. So when it comes to the discharge summary, this is again what goes with the patient. The white copy stays with us and the yellow copy will go with the patient. And so when you're going over this with the patient, there's a place for a discharge diagnosis, new prescriptions reviewed, it may not be applicable, and you can click non-applicable. Lab results reviewed, again, may or may not be applicable. And then pending labs, again, maybe that doesn't apply to her. Education reviewed and education handouts reviewed, these are probably appropriate for almost every patient that comes through. And the next appointment date and time, again, important to put that down if that's known. And then before the patient leaves, you can give her this entire piece of paper on a clipboard, give her a pen, lend her your pen, and have her fill out these questions. The reason this is important is because the whole point is that it's patient-centered. We want to know if this is working for her and if she has benefited from this whole process. And based on the results of the data that I've collected over the last 2 weeks, patients are clearly satisfied with and are learning a lot about this. And again, question number 3 on here is about the decision aid. So if that is something that you use, then she also fills out that question. If you have any other questions, please email me at aborders@salud.unm.edu, or you can text me. My phone number is in triage. Thanks so much for all your effort, and we're going to do this together.